Greetings and welcome back. This is Iris Heath. I'm a licensed clinical professional counselor coming to you with some education today about sleep hygiene. And basically, it just means your sleeping habits. So, I pulled an article that I have used with clients. It's an April 28th, 2020 article from the sleepfoundation.org, and it gives some really good information. Keep in mind, I am not a doctor or nurse, and so I'm bringing this as information that for you to look at for yourself, but information for you to take to your primary care physician. The article is entitled, What is Sleep Hygiene? Quickly, sleep hygiene is a variety of different practices and habits that are necessary to have good nighttime sleep quality and full daytime alertness. Keep in mind, there are things that we can do to either improve our sleep or to hinder our sleep. I don't know if you noticed this, but I have my robe on that family members gave me. And I'd like to present that. Dress for sleep. Set an environment that actually produces a desire to sleep. Set your room where you don't have a television. Consider if you're able to either not have your cell phone in your room, or that you have it turned over and silence it, or if you are a caregiver and you're concerned and feel like you need to keep it on, keep in mind that that may be disturbing your sleep. If you can switch off with another family member and maybe keep your cell phone in another room, there is research that there is something called a blue light in our cell phones, in our computers. If you're working from home, consider keeping your televisions and any media in another room, so that you have that space that's quiet. I know some individuals have, I believe, their Himalayan lights in their room, which produces a soft nightlight kind of effect. But if you're not able to have any light in your room, make sure that the curtains are closed, that you are keeping out some of the sounds and noises from outside. Some individuals, again, work with your doctor, depending on your age, benefit from 7 to 10 hours of sleep each night. So you may be closer to 7. I know that many of us have been taught an average of 8 hours is good. Write down on a piece of paper and write down what time you usually go to bed. Write down what time you usually get up. Is it falling within a period of a 7 to 8 hours? Some individuals, whether younger or older, need more than that 8-hour average of sleep. Look at what you're doing before you go to sleep. Are you steering clear of caffeine drinks, such as certain sodas have a lot of caffeine in it? Even some clear sodas like a Mountain Dew have a lot of caffeine. Please try to avoid that maybe an hour before you go to bed. Keep in mind that if you have a lot on your mind before you go to bed, that could affect your sleep. If you're getting up multiple times to go to the bathroom, some individuals are able to get up, go to the bathroom, get a sip of water, and lay right back down. And so they can get to that REM sleep, REM. That's where we get the most restful sleep. There's research on this, and that will help you get up and feel more refreshed. Limiting daytime naps is what this article says. They're saying to limit it to no more than 30 minutes. I usually suggest 30 to 60 minutes tops, because if you're doing more than that, it could throw your bedtime sleeping hours off. And exercising. The article stating somewhere around at least as little as 10 minutes a day. Usually, again, some research shows 30 minutes a day at least, 5 times a week, 3 to 5 times a week, if not a full 7, will help you. It helps to relax your body, helps to get you to that place where you feel like sleeping. Steering clear of certain foods prior to bed, getting enough sunlight. I already said setting a mood for sleep, and establishing regular bedtime hours, and just making sure that if something is off with your sleep, that you're actually addressing it with your doctor. If you take sleep medications, prescribed medications, please make sure you're taking them according to how they're prescribed. If something is off with that, stop to think about, are you under additional stress? Are you dealing with grief? Are you seeking treatment if you recognize that you've been dealing with it for a period of time and that pressure has not let up? That may be something someone can work with you on. So, this is a conversation. This is a conversation for you to have with your doctor. Do you need a sleep test? Some individuals have sleep apnea. Some people have to sleep with masks for periods of time. There are different things that people do benefit from. And please consider, if you're not getting restful sleep, if it has been some time. Some people journal prior to going to bed, pray, read their Bibles, whatever your faith community is, there are habits. And so the research shows that habits are developed within somewhere between 20 and 66 days. Depends on the research you look at. Keep these things in mind. So if you're not sleeping well, if you have a nighttime job and it's throwing your sleep off, there are adjustments that can be made. You can change your sleep habits. So again, talk to your doctor about it, work on it, write some things down to take with you, and continue to be well and encouraged. Until the next time.